Let's come over to the wall. We're going to bring our arm into a cactus position, and we'll take the same leg as that arm back into a lunge to stretch out the calf, twisting away from the arm on the wall, opening up both the pec minor and our gastrocnemius. Make sure that front knee is tracking forward. There's a soft bend in the back knee as you drive the heel down so we don't go into hyperextension with that back leg. Pelvis is tracking and pushing forward as that back heel drops down. Make sure you tip your tailbone back a little bit to create some lumbar extension. That's going to feel great. Pull the belly in towards the spine. Roll those shoulders back onto your back. Keep your head up on your spine. Apple distance between the chin and the chest. Hear your exhales. And go ahead and switch sides, setting up for that calf and pec minor stretch on the other side. We're warming up before we learn our exercises for level 2 trampoline for sway back and flat back posture. So as you're breathing here, notice if you're locking out in that back knee, keep it soft. Push the pelvis forward in opposition of the heel dropping down, that back heel. Stretching out the calf for more range of motion once we begin on the trampoline. Also opening up the chest so that when we use the bands, there's enough range of motion that we're not gripping in the front of the shoulder or the chest. Instead, we're using the upper back extensors. Inhale, brace those abs. Exhale, let me hear that exhale as you twist away from the arm. And inhale, fog of air, twisting away. So for our first exercise, we're going to learn all 3 exercises on the trampoline, and then we'll begin our cardio burst. So only work at 50% effort here just to learn the exercises. You're going to need your lightest Theraband and your ball. The ball goes between the knees. The lightest Theraband you wrap from the ends, holding it like a jump rope to start, creating a serratus anterior hold, isometric hold here. From here, we're going to begin in the transverse plane, the turning plane. You're going to bounce 4 times with the knees soft, shifting over to your dominant leg for 4, turning for 4, and then turning back to center for 4, and then back to 4 center on both legs, 4 on the non-dominant leg, 4 turning back. So it's just a quarter turn, 4 center. So it's very important that we work in the transverse plane because it's where 90% of injuries occur. So training in it can really help prevent injuries and enhance sports performance. So finish up whatever set you're on just so you're even. And then let's set down that lightest Theraband and grab our second to heaviest. You're going to bring that second to heaviest Theraband behind your shoulder blades, coming under the armpits, creating a serve the platter arm position. Guide the chest back towards the shoulder blades, closing the ribs, pull the abs in, keep your focus up eye level. From here, we'll bounce with the ball between the knees. We'll bounce for 4, and then we will kick our butt with our non-dominant heel and go forward for 4 and back, forward and back for 4, and then back to double legs for 4, and then to our non-dominant leg to go forward and back for 4. So notice the center ones where you're kind of you're setting up again. Those are not moving forward and back. Those are in place. And then the single leg work is forward and back. Keep the range of motion small for now. It's a small trampoline and you want to stay safe. So our last exercise, we'll need that lightest Theraband. We can set that second to heaviest down. We'll be pulling out on it, creating a T, keeping our elbows soft, our wrist flat, and our arms within our peripheral vision. We're going to be going side to side now, so keeping a soft bend in the knees. You're going to start with 4 on both feet, shifting to your dominant leg, going side to side for 4, and then 4 on both feet, and then 4 on your non-dominant leg, side to side. We'll repeat this pattern, thinking about our breath, thinking about the knees staying soft, the focus of the eyes up eye level, tipping the tailbone back to keep a neutral pelvis, pulling the abdomen in. If you have sway back posture, bones of the big toes are heavy. The side to side movement can be challenging. Keep the range of motion small. Watch out for droopy elbows. Elbows should be up as high. Well, elbows can be micro bent, but they should be about as high as the shoulders. Be a little below. All right, so let's set up for our first exercise. Lower the arms for a second. We're going to be doing our exercise in the transverse plane. This was the turning plane where you had your serratus anterior hold of the arms. You did 4 center, 4 on your dominant leg, 4 turning, and 4 to turn back. Then you repeat on the non-dominant side. Okay, counting you in for 3, 2, 1. Give it all you got. 100% effort here in the transverse plane. Level 2 trampoline work. Excellent for endurance training, for the lymphatic system. If you know anybody suffering from cancer, if you are suffering from cancer, this is an excellent way to condition your body. One of the highly recommended ways of training the lymphatic system and working on endurance and improving health when you're undergoing chemotherapy. So please refer any of your friends, family, or coworkers that are undergoing chemo for cancer to YouniquelyFit for our trampoline program. So you're almost there. You're working in this transverse plane where 90% of injuries occur. We're building muscle memory, combating the plantar flexion in the ankles and the supination in the feet. Counting you down. 3, 2, 1. Take your break. We're going to repeat this exercise one more time in the transverse plane, but you have a full minute here. So take some water, take a stretch. I'll give you ample time to set up. Anything that needs stretching, now's the time before we begin again. I know holding that upper body still and pulling out of that band for a whole minute is a lot of work. So your upper body may be needing a little extra attention right now. I'm going to let you know when it's time to set up. It's coming up. So let's go ahead and get set up. You've got 20 seconds. I want to give you ample time to get your hands wrapped around those bands so that you can set up in the serratus anterior isometric hold. Once you have it, you can lower it before we begin. I'll count you in. Okay, 3, 2, 1. Soft bend in the knees. Transverse plane first. 4 center. 4 on the dominant leg. 4 turning. 4 turning back. 4 center. 4 on the non-dominant leg. 4 turning. And 4 turning back. So keep this going, keep this pattern going. And now check in with your checkpoints. If you're sway back, the bone of the big toes is really heavy as you press. Your knees are soft. Your tailbone is back, so you're not rounding the low back as you're working. Your abs are pulled in tight. You're lifting in and up on those muscles that stop your stream of pee. Your shoulders are on your back, collarbone wide, head up on the spine. You're doing great, almost there, hang in there. 100% effort, quality of movement, awareness of the core, awareness of your eye focus, counting you down. 3, 2, 1, take your break. As you're taking your break, I'll remind you of our next exercise, traveling forward and back in the sagittal plane. We have our second to heaviest Theraband behind our shoulder blades, wrapping from the ends, knuckles over the knuckles with the thumbs on the outside, creating a serve the platter arm position. Think about the chest reaching for the band behind your shoulder blades And then we begin with 4 bounces with the knees soft, and then 4 on our dominant leg going forward and back, 4 center on both feet, and then 4 on our non-dominant leg going forward and back. Remember to keep your feet parallel, and that means you're from the top of the hip sockets, the leg bones are parallel. Don't rotate from the knees or the ankles. That's going to cause discomfort. Go ahead and get set up. I want to make sure you have enough time. I'm going to count you in 5, 4, soft knees, 3, 2, 1. First set here in the sagittal plane, level 2 trampoline work for sway back and flat back posture. Make sure you're giving me 100% effort, keeping the range of motion small, keeping your focus up eye level. Watch out for that chest spraying forward. Remember, the chest is reaching for that band behind your shoulder blades. You actually have a visual there to imagine the softening happening in the front of the body. Pull the belly button in towards the spine. Tip your tailbone back. Imagine you're laying over that anti-burst ball with your low back. You want to create some extension in your lumbar region. Pull the belly button in. Hear your exhales, soft knees. Gaze up eye level. You're doing great, almost there. I'll count you down. 5, 4, 3, 2, 1. Take your break. Water, stretch, or just stand still. If you're just standing still, make sure you're not sitting into one hip. I want you to work on balancing out those legs by softly bending both knees and staying aware of equal weight distribution between your legs. We have one dominant leg due to a lot of factors, but one of the biggest ones is standing and sitting into one hip, strengthening one side while the other side atrophies. So be aware of this. I'm going to let you know when you've got 20 seconds so you can set up for our final set in our sagittal plane. 20 seconds left. Get set up. I want those arms in the serve the platter position, ready to go. Soft bend in the elbows, soft bend in the knees. I'm going to count you in. 5, 4, 3, 2, 1. Give me 100% effort here. Final set in the sagittal plane. Remember, we're going forward and back. When you're center and on 2 feet, you're not moving forward and back. This is your reset. And then you begin again on the non-dominant leg, alternating. Now, if you really are struggling, I find that my non-dominant leg, it has a lot of catching up to do. So sometimes I'll do extra repetitions on the non-dominant leg just to build the strength and even everything out. So you may want to consider 4 center, 4 on the dominant leg, and then 8 on the non-dominant leg. Something to consider if you do notice a significant difference in the ease of one side versus the other. Keep up the good work. Keep your abs involved. Keep your head on your spine. Apple distance between the chin and the chest, counting you down. 4, 3, 2, 1. Take your break. As you're taking your break, just watch. You need your lightest Theraband, arms in the T, knees soft, 4 bounces center. Dominant leg, 4 side to side, 4 bounces center. Non-dominant leg, side to side for 4, or 8 if you notice a big difference in that non-dominant leg. I myself like to do extra repetitions on my weaker side. I feel like I'm balancing the body out, and that's one of the most important things with exercise, is to fix muscle imbalances. This prevents injuries and it allows you to excel, and it enhances sports performance so you can excel. All right, go ahead and get on up on the trampoline. Bring the arms to a T, soft bend in the elbows, soft bend in the knees, counting you in 5, 4, 3, 2, 1. 100% effort. First set here in the frontal plane, side to side motion. This is a challenging one. You've got that ball between the knees, or rather between the inner thighs, slightly above the knees. You're squeezing it, working those adductors. If you have sway back posture, think about the bones of the big toes being heavy. If you have flat back posture, just make sure that the heels are making contact with the trampoline as much as those toes, the metatarsals. You want those heels to have pressure as well. Keep the bounce low. Don't go crazy on extending the legs fully. And remember that side to side motion, keep it small. Range of motion is not important yet. It's all about control right now. Counting you down. 4, 3, 2, 1. Take your break. Final break before our final burst in the frontal plane side to side. You've done wonderful work. Keep showing up. I'd suggest doing a strength and toning series 3 times a week. We have full hour classes. We have 10-minute options, 30-minute options, and then doing cardio 3 times a week. Always warm up, and I always encourage you to do flexibility afterwards. Your muscles are warm. This is where you can really increase the range of motion, and that's also important in injury prevention and enhancement in your sports. So let's get set up. I'm going to count you in shortly. Remember, we're going side to side. Arms are held in a T in your peripheral vision. Elbows are soft, wrists are flat. Counting you in. 3, 2, 1. Let's give it all you got. Keeping the knees soft, abs braced, tailbone back. Make sure you're not rounding that lumbar. Head is up on the spine. Focus is up eye level. Apple distance between the chin and the chest. Inhale laterally. Tip that tailbone back even more than you think you can. Remember, 2 options. 4 center on both feet, 4 on the dominant leg side to side, 4 center both feet, 4 on the non-dominant leg side to side, or 8 on the non-dominant leg side to side. You choose, but keep your focus up, keep your back involved, keep your abs involved. Remember that the front of the shoulders and the chest should not be gripping. If you need to lose the band because it's too much, lose the band. I'd rather you do that than overwork areas that are already tight. Counting you down. 4, 3, 2, 1. Great work. Take that minute recovery. Grabbing a sip of water, taking any stretch that feels necessary after that cardio burst work. So every time you work with us on your endurance, remember, cardio bursting is the most time-efficient way to condition the heart, but you should be pushing yourself to the limit. As hard as you can go with the awareness of your checkpoints. Your abs are always being braced. You're always thinking about what's happening in your feet, your knee traction, your rib cage, your neck alignment, retracting your chin so the back of the neck is long and the front neck muscles are working. We're going to move into some flexibility now. Setting up for a wall calf stretch, facing the wall, feet are hip distance apart, stepping one leg back for a calf stretch, opening up the gastrocnemius here, driving the heel down as the pelvis drives forward, tailbone reaching away, little lumbar extension. Without pushing the rib cage forward, close those front ribs, plug the shoulders down the back, retract your chin, back of the neck is long, eyes should be focused eye level. And think about your breath. Inhale, pull the abs in, lift up on the muscles that stop your stream of pee, hold that lift, driving the heel down and the pelvis forward at the same time. Again, inhale laterally into the rib cage, pull the belly button in, lift up on those muscles that stop your stream of pee, hold it, sustain it, drive the heel down and the pelvis forward. Keep going with that breathing. Back of neck is long, collarbone is wide. That front knee shouldn't be tracking beyond the metatarsals. Go ahead and step that back leg forward. Start with the legs hip distance apart, stepping the opposite leg back. Look over your shoulder. Is the leg perfectly parallel? That includes the foot. Drive the pelvis forward as you drive the back heel down. On your exhales, inhale through the nose, pull the abs in, brace the stomach as if you're going to be punched in the gut, drive the pelvis forward and the hips and the heel down. Exhaling the air out the mouth. Be cognizant of your breath. Your eye focus is also important here so we don't encourage that forward head syndrome. So retract your chin. Give me a double chin so the back of the neck is long. Watch out for the shoulders elevating. Keep them plugged down. Sternum reaching towards the back ribs, closing, allowing access to the lower abdominals and the upper back. A few more seconds here. We'll move into a quad release on one side, kicking one heel towards your butt, grabbing the outer ankle, dorsiflexing the foot, soft bend in your supporting knee, bone of the big toe of your supporting leg heavy in the floor. Inhale, exhale to drive that thigh back, bracing the abdominals. Inhale, abs in, contract. Exhale, drive the thigh back. 2 more breaths. Inhale, contract, exhale, and inhale. Release the leg, turning and setting up on the other side. We're working on opening up the quadriceps after our cardio burst, all that hard work. Breathe in, make sure your supporting knee is bent softly. The bone of the big toe of the supporting leg is heavy, and you're really driving that thigh back on your exhale. We'll move to the floor for a prone floor twist, setting up a right angle, turning our head away from that right angle. That elbow of the right angle should be in line with the shoulder. Other hand by the chest, keep the head down as you spiral and lift the same leg as the hand by the chest, up and back. The knee is bent, the big toe is on the ground. Dorsiflex the foot to keep the knee safe here. You're getting an opening in the pec minor as well as your hip flexors. Use your exhale as a chance to deepen the twist. Inhale, prepare. Exhale, twist deeper. Inhale, prepare. And here is a great chance to work on those ribs not spraying forward. Even though we're in extension, we want to find our back. We want to bring the sternum in towards the back ribs so that our upper back can fire here and we can pull our abs in to support the low back. Inhale, brace your abs and spiral out of the twist, making your way to the other side, setting up, creating a right angle, elbow tracks right in line with the shoulder, hand by the chest, head is turned towards the hand by the chest, same leg as hand by the chest lifts up, spiraling around, dorsiflex the foot, heel can rest on the ground, but watch that the knee doesn't start to collapse down. Keep lifting up from the top of the groin. The hip flexor will stretch here. Inhale, brace the abs. Sternum reaching towards the back ribs. Exhale, twist deeper. Keeping the head down, the temples should be resting on the floor. Retract your chin to keep the back of the neck long. And make sure you're breathing. Inhale, abs in. Lift in and up on the muscles that stop your stream of pee. Fog a mirror as you twist deeper into this nice prone floor pec and psoas opener. From here, we'll move into foam rolling for your IT band. You'll be in a side plank position. Don't collapse into that shoulder of the forearm that's down. Use it as a chance to also condition the lats. We'll walk forward and back, rolling out the fascia on the outside of the thigh laterally. Breathing. You can put that top foot down, either behind or in front, if that's helpful, or if keeping it lifted in the air and stacking the legs feels better. This is also an option. Just make sure you're not collapsing into the forearm, into the shoulder of the arm that's down. Other hand can be behind the head to support it, on the hip, on the roller, wherever it feels like it's out of the way and you can focus on the fascia release of your IT band. Go ahead and switch sides, setting up. And if at any time you have one side that's significantly tighter than the other, feel free to go back. Most of the stretches we're doing now, unless they're a release, are postural, so we're holding for a full minute. So you can stay for a minute 20 or a minute 40 on your dominant side and do a quick release on the non-dominant if it doesn't feel tight. Make sure as you're rolling here, you're not spraying the ribcage forward. We want to always be engaging our abs and our upper back as we work. This will bring us into that optimal alignment and perfect our posture, combat the kyphosis, and help alleviate chronic back pain. 15 more seconds here, finding fascia in the IT band, that overactive lateral chain, the hamstrings, even getting up into the glutes as you roll up top. From here, we're going to come into a rectus opener, rectus abdominis opener, getting into the upper fibers of the internal obliques and the rectus abdominis. Hands behind the head, place the roller behind your shoulder blades, feet on the ground, tailbone reaching towards the feet for some lumbar extension, and we'll allow gravity to do the work as we extend our chest, elbows pointing out to the side, chin retracted. Press your shoulder blades into the roller. This will intensify the opening and the upper fibers of the abdominals where you're overactive. Breathe here. Be cognizant of spraying the ribs forward. Go ahead and push those back ribs and shoulder blades into the roller, intensifying the stretch. Inhale, abs brace. Exhale, press the back ribs, heavy, heavy, heavy. Chin retracted. Inhale, last breath, brace the abs. Exhale, press, 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 deepening and lifting up. We'll grab our ball to lie supine, placing it under our head for a figure 4 stretch, crossing our right ankle over our left and threading the hands through to bring the left hamstring towards the body. Opening that right thigh with the right elbow, dorsiflex the crossed leg foot so that you keep the knee tracking safely. Reach the tailbone towards the bottom of the mat in an effort to keep lumbar extension. And check in with your breath. Breathing in and exhaling. Deep inhale. Brace the abs, pulling that hamstring closer towards you as you open the opposite thigh, using the elbow as leverage. Go ahead and switch sides, setting up for your supine figure 4 stretch. You can also use this as a chance to stretch the back of the neck, giving me a double chin, retracting that chin, engaging your neck flexors to release the neck extensors. Make sure the foot that's crossed is dorsiflexed. The tailbone is down and reaching down towards the bottom of the mat, allowing you to access the upper fibers of the glutes as you pull. The glute med, the piriformis is opening. If you round your low back, you don't get the full attachment stretching. So make sure to try to keep the pelvis neutral and try and accentuate and reach the tailbone down and away from you for a subtle bit of lumbar extension. Just a bit longer here. 5, 4, 3, 2, 1. Our final stretch, we'll grab our heaviest Theraband. You can keep the ball under your head, hooking the band around the arch of the foot, sliding the other leg out long. We'll internally rotate the leg in the hip socket, taking it across the body for a deep IT band stretch. Reaching the tailbone towards the bottom of the mat, dorsiflex that foot, squeeze the front of the quadricep, lift the kneecap. You'll feel the peroneals, the outer calf, the outer hamstring, all the way up to the hip stretching. Do your best to take the rounding out of the lumbar. Imprint those back ribs into the floor at all times. Really activate them so we can turn off the pecs, the anterior delts, and recruit the upper back. Stay aware of your pelvic position, tailbone reaching away, collarbone wide, shoulders plugged down the back. Breathe in, pull the abs in towards the spine, lift up on the muscles that stop your stream of pee. Hold that lift. Bring the leg a little farther across. Go ahead and switch sides, bracing your abs, setting up. Internal rotation of the leg from the top of the hip socket, crossing the body. Dorsiflex the foot evenly from the outer and inner edge. Reach the back ribs into the floor, pressing them heavy, shoulder blades heavy into the floor. Chin can retract, lengthening the back of the neck, engaging your neck flexors. Tailbone reaches towards the bottom of the mat. Inhale. Brace your abs as if you're going to be punched in the gut. Deepen the stretch, dorsiflexing, squeezing the front of the quadricep and moving the legs subtly a little farther into the stretch. Inhale. Brace. Moving deeper into the stretch. Inhale. Abs in, contract them, hold the contraction, and exhale, deepening the stretch. Moving out of it with awareness, keeping the abs braced. Good job.